Is your cat acting a little off lately? Maybe they're not their usual playful selves, or perhaps you've noticed a change in their eating habits. Look, we all know cats are masters at hiding their discomfort. It's hardwired into their DNA, a survival tactic from their wildcat ancestors. But as their guardians, as the humans who share our homes and lives with these incredible creatures, it's our job to see past the stoicism and recognize the subtle signs that something might be wrong. That's what we're going to cover in this video. The top 10 signs your cat might be trying to tell you they're not feeling their best. We're talking about those easily missed cues, the ones that can sometimes be brushed off as just a cat being a cat. But trust me, as someone who's dedicated their life to understanding these amazing animals, these signs are important. We're going to break down each sign, talk about what it could mean, and most importantly, what you can do to help your furry friend. Because early detection is key, folks. It can make all the difference in the world when it comes to your cat's health and well-being. So, let's dive in and learn how to better understand those subtle messages our feline companions are sending us. All right, let's start with a big one: loss of appetite. Now, we're not talking about your cat skipping a meal after a particularly gluttonous feast. We're talking about a significant decrease in their food intake, or worse, a complete disinterest in eating. This is a major red flag, people. Cats are hardwired to eat. It's in their nature to hunt, to scavenge, to consume. So, when a cat stops eating, it's a sure sign that something is amiss. Could be a whole range of things. Dental problems, maybe a nasty toothache making it painful to chew. Could be digestive issues, something upsetting their stomach. In some cases, it can even signal something more serious like kidney disease. The point is, don't wait around hoping for the best. Don't chalk it up to your cat being picky. If you notice a sudden and persistent loss of appetite, especially if it lasts for more than 24 hours, it's time to pick up the phone and call your vet. Early intervention is crucial, folks. Don't delay. We've all been there, right? Cleaning up a hairball surprise left by our feline overlords. It's part of the deal when you share your life with a cat. But here's the thing. There's a big difference between the occasional hairball and frequent vomiting. If your cat is throwing up more than usual, if it's happening multiple times a day, or if you're seeing blood in their vomit, it's time to take notice. Just like with appetite loss, frequent vomiting can indicate a whole host of problems. Could be something as simple as a food allergy or sensitivity, or it could be something more serious like a gastrointestinal obstruction, pancreatitis, or even poisoning. Pay close attention to what your cat is throwing up. Are there any foreign objects in there? Is the vomit bloody or discolored? This information can be extremely helpful for your vet, so take note and don't hesitate to seek professional help. Your cat's health depends on it. We all know cats love to sleep. I mean, they've practically elevated napping to an art form. But there's a difference between a cat enjoying a well-deserved snooze and a cat exhibiting lethargy. Lethargy is a general lack of energy, a state of prolonged tiredness and disinterest. A lethargic cat will sleep more than usual, show little interest in play, and might even seem withdrawn or depressed. Now, I know what you're thinking. Jackson, my cat sleeps all day. That's just what they do. But trust me, you know your cat better than anyone. You know their routines, their energy levels, their quirks. If you notice a significant change in their activity level, if they're suddenly sleeping all the time and seem uninterested in their favorite toys or activities, it's time to pay attention. Lethargy can be a sign of a wide range of health issues, from infections to dehydration to metabolic disorders and even heart problems. Don't ignore this sign. It's your cat's way of telling you something's off. Just like with humans, maintaining a healthy weight is crucial for our feline companions. Sudden and unexplained weight changes, whether it's weight loss or weight gain, are always a cause for concern. If you notice your cat is losing weight rapidly, it could be a sign of hyperthyroidism, diabetes, intestinal parasites, or even cancer. On the other hand, rapid weight gain can indicate hypothyroidism, Cushing's disease, or even heart problems. Now, I know what you're thinking. Jackson, my cat has always been a little on the chubby side, and that's fine as long as their weight is stable and they're otherwise healthy. But what we're talking about here are sudden and drastic changes. If you notice your cat's body condition changing rapidly, if you can see their ribs or spine protruding, or if they've suddenly ballooned in size, it's time to schedule a visit with your vet. All right, let's talk about a scary one: breathing problems. This is one sign you absolutely cannot ignore. If your cat is struggling to breathe, if you notice them wheezing, gasping for air, or making unusual noises while breathing, it's an emergency situation. Difficulty breathing can indicate a whole host of serious problems, from respiratory infections like pneumonia to asthma, to heart failure, to even an obstruction in the airway. Don't wait around hoping for the best. This is not the time for home remedies or watchful waiting. If your cat is showing signs of respiratory distress, get them to a veterinarian immediately. Every second counts in these situations, so don't delay. Cats are creatures of habit. They thrive on routine and predictability, so when their behavior changes, it's a sure sign that something is up. Now, these changes can be subtle. Your usually affectionate cat might become withdrawn and start hiding more than usual. Your playful, energetic kitty might become lethargic and disinterested in their favorite toys. Or your typically laid-back feline might start acting out, becoming more vocal, or even displaying aggression. Any significant change in your cat's normal behavior should be noted and taken seriously. It's their way of communicating that something is wrong, even if they can't tell you directly. These behavioral changes could indicate pain, stress, anxiety, or even an underlying medical condition. Chapter 7. The water bowl, a telltale sign. Keeping a close eye on your cat's water intake is crucial. Just like with food, any significant changes in their drinking habits can be a red flag. If you notice your cat is suddenly drinking a lot more water than usual, it could be a sign of several health issues, including diabetes, kidney disease, hyperthyroidism, and even certain types of cancer. On the flip side, a decrease in water intake, especially if it's accompanied by other symptoms like lethargy, vomiting, or constipation, can be a sign of dehydration, which can be caused by a variety of illnesses. Chapter 8. Litter box. Trouble. When nature calls for concern. Let's be honest, nobody likes talking about litter boxes, but the truth is, your cat's bathroom habits can reveal a lot about their overall health. Pay close attention to any changes in their litter box routine. Are they straining to urinate? Are they going more frequently than usual? Are they having accidents outside the litter box? Have you noticed any blood in their urine? These changes could be a sign of a urinary tract infection, bladder stones, feline idiopathic cystitis, or even kidney problems. Chapter 9. Coat check, a healthy shine or a cry for help. We all love a soft, fluffy cat, but a cat's coat is more than just a source of endless petting pleasure. It's a reflection of their overall health. A healthy cat will have a clean, shiny coat that's free of mats and tangles. They'll groom themselves regularly, keeping their fur in tip-top shape. But if you notice changes in your cat's coat condition, it could be a sign that something is amiss. If their fur is looking dull, greasy, or matted, if they're shedding excessively, or if they've stopped grooming themselves altogether, it could be a sign of stress, allergies, parasites, or even an underlying medical condition. Chapter 10. Bad breath. More than just a fishy situation. Let's be real, nobody expects their cat's breath to smell minty fresh. But if you notice a sudden and drastic change in the odor of your cat's breath, if it's particularly foul or unpleasant, it's time to take notice. Bad breath, especially if it's accompanied by other symptoms like drooling, decreased appetite, or difficulty eating, can be a sign of dental disease, which is extremely common in cats. But that's not all. Bad breath can also indicate other health problems such as kidney disease, liver disease, or even diabetes. Chapter 11. Your cat needs you. Be their advocate. So there you have it, folks. 10 crucial signs your cat might be trying to tell you they're not feeling their best. Remember, cats are masters at masking pain and discomfort. It's in their nature to hide their vulnerabilities. But as their guardians, as the humans who love and care for them, it's our responsibility to learn their language, to recognize the subtle signs they're sending us. Catching these signs early can make all the difference in your cat's health and well-being. It can mean the difference between a simple treatment and a more complicated, costly, and stressful situation. Don't hesitate to consult your veterinarian if you notice any of these symptoms. Your furry friend depends on you. If you found this video helpful, give it a thumbs up, share it with fellow cat lovers, and subscribe for more tips on keeping your feline friends happy and healthy. See you in the next video.